Just to put it into context, and some of this has already been discussed earlier today, we all know the pressure that clinicians are under these days and the amount of admin that they need to do and the pressure and the burden that that places upon them. As part of Rio Reimagined, we've obviously looked at how Rio is being used today and how that translates into time spent. And while Rio is a very complex system, we all know that, 20%, roughly 22%, I should say, of time in Rio is spent on progress notes and assessment forms. But we also know from speaking to clinicians and users, that's not even a true reflection of the time that it takes, because a lot of that documentation happens in Word first, or in the Notes app, or in a good old-fashioned notepad. So we know that that time is better spent elsewhere, but we also know that that's adding a lot of pressure onto clinicians as well as they go through that process. So what we did to start with that data, we met with trusts across the country to understand the workflows and how we could try and integrate a solution like Smart Notes into day-to-day clinicians' operations. So a key thing for us was making sure that we weren't saying, here's this great new product, off you go and use it, but to understand from a clinician point of view how we could fit into their day-to-day. So I will just say at this point, a massive thank you to all the trusts that met with us, that provided access to their clinicians, that sat through interviews, because we can't speak highly enough of that work that we've done. So the early adopters that we're working with, like Oxley's as well, that effort is really helpful. So you will hear from us more on this as we go through the day and as we go through Rio Reimagined. So that engagement is really, really valuable. We met with over 50 clinicians. We did over 30 hours of user interviews. And that really helped us to understand both the perception of AI, so the potential value, but also people's concerns and fears about AI, but also how they work, the pitfalls, the difficulties with using Rio in the community or laptops or whatever it might be. That was really helpful to set a base for us to understand what we were then going to go off and build. So with Smart Notes, a few key themes would come out from users, and we've heard a lot about that today as well. Some of it is memory. And so if we're seeing a high caseload of patients, trying to remember that in the right level of detail to deliver accurate notes is tricky. We also have the potential benefits as well. And so I'm not saying this quote is necessarily representative, but in this case, a clinician said that if they could reduce their admin, they could potentially double their face-to-face time with patients. I will say, definitely we have the opposite view, that they don't want to see more patients, but the idea being that time can be used for training, for quality improvement, for more time with patients. It can lead to better outcomes for patients as well. And I think that was nicely summed up through a mental health clinician who said, at the end of the day, we're all about patients. So that's what we're trying to achieve with Smart Notes, is something that supports both clinicians in their workflow, reduces that burden, but also has an impact on patient care as well. So with that, a little summary of what clinicians told us. Firstly was both a general openness to AI, but also some caution. And so I think the potential there around efficiency and time saving, people recognize that, but they had concerns around accuracy, particularly around things like accents and background noises, and those kind of concerns. And some of that came from using more traditional dictation tools and existing systems that they'd used already. So that was something we needed to try and address as well. There were concerns about consent and ethics as well, and James will touch on that a little bit later on. But again, the benefits came out really clearly. So the potential to improve the therapeutic relationship between the patient and the clinician, the ability to maintain that trust with patients as well by going through a consent process, but also, of course, that saving time and that workload pressure as well. So once we had done our initial period of research, we then moved into a prototype. So again, big thank you to Oxy's part of this. We went on site for 3 days, so we took an entire team. We let some of the developers out of their rooms and into the light with our team. And we went down and we met with, I think, 13 different clinical teams across Oxy's. So across 3 days, we met with different teams. We ran through mock scenarios with a prototype of the app to, again, understand how people would feel about it, what they sort of thought about the output, and again, the benefits that they thought they could deliver through that as well. Feedback was generally really positive. A common theme, and I know I would say this as the product manager for it, but a common theme was, when can we have this app? So we've done that at multiple trusts. A number of you will have had me on site for demos, and the potential benefit users can see. Some of those concerns still exist, but that benefit and that time save, they can really understand and see the benefit that that could deliver as well. The other benefit of coming on site was we had our user experience team with us, and so they were able to listen to that feedback, see how users were interacting with the app, and then redesign as we go. So while we're on site with Oxley's, we had a prototype. By the time we left, we had an entirely redesigned version as well. So sessions like that are really helpful. So if you do hear from us in the future asking to come on site and meet with your teams, I'm just going to say again, we would love that. So that would be great. So I'm going to hand over to James just to touch on a little bit from his side, and then we'll get into the demo.
Yeah, so I think what Simon and I wanted to do was just give a little bit of different perspective. So this is kind of rewinding a little bit from an Oxy's point of view. We've had a digital dictation solution in the trust for a number of years, and we got to a point early in 2024 where we were looking at renewing our product around that. And what we wanted to undertake as we try and adopt a much more design-led thinking approach within Oxley's is we wanted to go through a good discovery process with our staff to understand their needs, but we also knew that ambient voice technology or AI scribes were coming down the road. Actually, I don't think we'd actually had a contact with Access Group at that point about smart notes, but we knew that technology was in the ether. I think I first tweeted about this technology 10 years ago, so I've been waiting a long time for it. So we wanted to understand our staff experience of the workflow now, understand staff experience of current technologies, in-depth user interviews across all the directorates. So we employed one of our clinicians who was interested in design, and they spent every Friday interviewing various clinicians about their experiences of using digital dictation. And we also got some demos from other suppliers as well, and I'll touch on the hackathon a bit. Generally, what was interesting, we found, and this, I'm sure all our trust colleagues will find this, that staff spend a lot of time doing administrative tasks, spending their own time in their pajamas at home, catching up on their notes. One of our district nurses said something along the lines of they spend 3 hours at the end of their shift catching up on all their notes. Digital skills and workflow varied, and actually, it can build in additional time. People were working in such a way that these tasks were taking them longer. Current digital dictation had a mixed impact. Some people felt they hadn't got the opportunity to use it. The people who used it struggled where it wasn't accurate. They had to work really hard around accents and different kind of medical terminology at time. So people gave up on it quite quickly, I think, is the takeaway. Environment matters. We've moved, like many trusts, to open plan offices, and that actually was a huge barrier to people using digital dictation. They couldn't sit there and try and dictate a letter whilst there was a whole cacophony of telephones going off, people coming in, disruption and so forth. And it was impacting on staff experience. So we looked just more relevant to ambient voice technology. We took this opportunity to ask them. They did have what was their kind of concerns about this new ambient voice technology, and we played them a demo during the interviews of the DAX product, the Nuance product, not the Smart Notes product. So that was just a kind of caveat. They were open to trying it, but they did have some concerns. Were their managers going to make them do more work? They had previous top-down experience with previous top-down implementations, and they didn't really like that idea. They wanted a strong preference for sort of training that provided opportunities to fail within a safe space rather than, just kind of being given the technology and getting on with it. So lots we learned about how we're going to implement Smart Notes as we go forward over the next few months that was really valuable. In terms of the concerns, accuracy, I think, is going to be the huge litmus test as we move forward with Smart Notes and other ambient voice technology products. Relevancy, will the AI choose the right information from all the chat that we might have? Again, that will then add that burden back to the clinician. They have to add that information back in. Limitations of use. I think there was a sense that if you were having a sensitive conversation, it might not be appropriate to sit and record the conversation. So I think there were some concerns from some staff. If you were doing a psychotherapy session, did you and the patient really want to have that extra thing in the room in terms of recording? Management of response to impact. Yeah, again, that sense that are we going to just expect them to do more? So I think that's something we're going to have to really tackle. Experience of previous technology differentiated. So interesting, we looked at if you've used digital dictation technology before, what was your attitude towards ambient voice versus if you'd never used digital dictation? And actually, people who used any form of digital dictation were much more hopeful and optimistic about new technologies. So thinking about implementation in your organizations, actually you might see that the ready adopters are people who've used similar technologies before. You might have to work harder with those who haven't. These are some of the comments. I think I wanted to just pick out a few. Definitely the point about eliminating hours of work doing documentation. A point about junior doctors or junior staff. You know, reviewing notes and the skill of writing notes is a part of professional skill. If we take that opportunity out, imagine the day when Smart Notes isn't available for whatever reason or other products, you know, are the junior doctors or junior staff going to know how to write a decent letter if they've never had to because the technology has taken over from doing that, which is, I think, a really interesting point. There was definitely some concern about the ethics of it, and again, that sense of, oh, I'm not sure that technology should be used. So again, I think that's something we're really going to have to think about as we move forward with implementation. So I think, just finally, thoughts from us on the hackathon. My reflection to other trusts was it was a great experience. We really enjoyed working with Simon and his colleagues. They brought down the whole UX team, the technical developers. It was a great piece of digital work. It took a lot of logistics on our side to organize different rooms. I spent, about 20 minutes driving around a car park, trying to park the car.
45, I think.
So logistics is the king when it comes to organizing these kind of hackathons with your staff. We're really grateful for all this time. But what's been interesting as we look forward, the teams that were involved in the hackathon are now much more enthusiastic about the Smart Notes pilot that we've got coming up than those teams were who weren't involved in the hackathon. So if you're kind of trying to build that anticipation in the organization, doing these kind of events, engaging with Access Group in this kind of work is really important. They really were kind of low-fidelity simulation sessions. I think Simon's covered some of this. They were impressed by the usability, they're impressed by the accuracy, and they want it now. So again, we've built that enthusiasm within the organization. So on that note, I wanted us to get on the demo.
We will switch over to the iPad then so you can see the demo. While I'm just loading this up as well, what I will say is obviously some of that feedback, some of that concern from users has fed into how we've developed this as well. So those concerns are part of how we've approached this. The other thing I would say as well is many of you will have seen NHS England's guidance last week and a half ago, around ambient voice as well. So we just want to reassure everyone that as part of the work that we're doing at the moment, we are, while it is guidance and not law at the moment, we are taking the proactive approach to go down Class 1 registration with MHRA. So that's something that we're doing on an accelerated timeframe, and so we're hoping to have Class 1 within about a month as well. But boring stuff over, let's take a look at the actual app so you can see it. So I am saying this is a live demo. What I should say is that yesterday, James and I recorded a mock clinical session. So I can attest to James's clinical expertise. I pretended to be the patient, and we did a half-an-hour session yesterday. So what we'll take you through now is that session, or at least some of that as well, so you can see what it is. So key thing here with Smart Notes is it is directly integrated within Rio. So when you first log into the app, what you're going to see is your Rio calendar. So at the moment, this is based on appointments, but in the future, you'll also have the ability to look at patients by ward, and even there'll be a desktop version as well in the future. But at the moment, it's a mobile app for both iOS and Android. So when we look at a calendar, we can see the appointments that we have scheduled. We can see things like the patient name, the location of the appointment, the consultation medium, and also the status of the appointment as it attests to Smart Notes as well. So if we open up an appointment, what we'll see is some basic information about that patient. So we've got a new patient banner that's got the NHS number, Rio ID. We're also pulling in any alerts and allergies from Rio as well. So that integration with Rio directly is allowing us to surface more data about the patient before you see that patient as well. We also have contact info, so we've got the address and phone numbers, and if you're on a SIM-enabled device, the phone numbers can actually be used to call the patient directly from the app as well, so you don't need to jump out and into your phone as well. And then if you book them in Rio as well, I know not everyone always populates the intended activity fields in an appointment, but if you do, that will populate in here as well. The key thing, though, is obviously when we come in to record, you've got a consent process. So I won't go through that in too much detail today, but consent is built into the process so that we can make sure a patient is confident and comfortable being recorded before we start that session as well. You can, if you don't have consent, use it for dictation, but obviously the key benefit here is if we use it for that ambient voice as well. So we can go ahead and start a recording, and then you have your consultation, your appointment with the patient as you would normally, and to demonstrate some of the information around background noise and those concerns, on our roundtable earlier this morning, I did use it to record our session, and despite the 10 conversations going on around the room and the amount of background noise, it did pick up the conversation quite nicely, and it summarized that as well. So around background noise, we're quite confident in what it provides, and we've tested in a number of scenarios for that as well.
and during the hackathon, we had great fun playing dog noises in the background. We had an alarm going off. We had people swearing in the background. So again, really good fun testing out the limitations of the
I
product.
will say James makes a very good stroppy teenager, because at one point he sort of slammed into the room. So this is just an example template. So I think the key thing to note as well is when you have recorded a conversation, the user gets to determine the template that we summarize that into. So in this context, we've selected an SBAR, but eventually we will have things like assessment forms in here. We'll have a range of different templates that the user can choose based on the content and the appointment type that they're having as well. So as I say, we had a consultation yesterday, which I guess was an initial mental health assessment.
Yep.
And so James took me, although I was Chris for that day, but took us through a session of family history, background, some of the issues, medication that we'd gone through as well. And so we can see that summary as we go through. So in this case, we've got all of that information has been nicely summarized. And what we can do as a clinician is when we're reviewing this, I don't like my own voice, but here we go. You can play back the entire conversation. So if I hit play in a second, because there's, I think, a bit of dead air at the start, it will play back the conversation. If I scroll forward. Oh, the audio's turned down. That would help, wouldn't it? Or is there no audio on? Oh, maybe it being plugged in stops the audio. Oh, well, there we are. I can show you afterwards if you'd like to see the audio, but it would play back the whole appointment, so you can hear that. But the key benefit here is as you're going through it, if you need to verify some information, so if you're not certain or you want to add more context, you can edit any section, of course, but the playback button for each section is timestamped audio. So rather than having to listen back to a whole 30-minute appointment, you can jump to the specific point of the conversation and hear back exactly what you said and what the patient said as well. So up until the point you submit it, you have that verifiability of the information in the summary as well. So what I will do is just obviously as the clinician is just ask James to have a quick read through and reference how you think the app has summarized this as well.
Yeah, so I think it's done a pretty good job. I think what if you scroll down, I think one of the things I just noticed is when exploring sort of somebody with low mood, you're looking at worthlessness, hopelessness, and helplessness. And in fact, Simon described when he was playing Chris that he didn't feel helpless. And actually what it hasn't picked up is that kind of negative finding, if you like, of helplessness. It's described that he felt worthless and hopeless, but what I would want to add in there is that actually Simon felt that there was help out for them. He didn't have that sense of helplessness. So if you go further down, I think there was, this was all good, looking at his anxiety, how much he's sleeping, the impact it's having on his sleep, and the recommendation for CBT. And then monitor the effect of he was on medication. So this is all good. I mean, what I wanted to reflect on while we're looking at this is when I was talking to Simon, I did a couple of things that I hoped helped the AI understand what I was trying to do. In communication skills, when you're working as a clinician, you can do something called signposting, which is letting the patient you're going to ask them a question later. I'd like to talk to you about whether you've had any dark thoughts about not wanting to be alive. I'm going to talk about that a bit later, but can I just return to talking about your sleep a bit more? So that's kind of signposting. It's letting the patient know that you're going to ask them something in future. But what it also does is it lets the AI know you're going to talk about that as well. And you can do something called chunking and checking, which is where you chunk up your history. So you say, and we did this, didn't I? I did this, Simon. I think if you could listen to the recording. I asked him about his sleep, and I said, so what you've told me about your sleep, Chris, is that you sleep for 4 to 5 hours. Your sleep is often disturbed by your anxiety. Right, now I'd like to ask you about, your wider family history about, I don't think it was quite that, but that's, So there's this idea of chunking and checking. So I think as a clinician, what I think we need to help our, fellow colleagues do is it's actually bringing out the best in you as a clinician. These are the things that you should be already doing. And, if we go back to that phrase, rubbish in, rubbish out, if you do a bad assessment, don't be surprised if the technology struggles to make sense of it. If you can do a good, structured assessment that has good communication skills in it, it really will help. And again, from a plan point of view, I think when I was doing it, I was really clear to set out for Simon and the AI what the plan was. And I think that's then helped with the accuracy of this. I think ideally we'd put this in a slightly more structured process, and we talked about that, and that's something we'd look to develop. I think getting the balance right around the headings in the templates that we use going forward is going to be, again, a key part of making this technology work. because if you can get the headings right, so the model behind it knows what you're trying to do, then I think that hopefully that will reduce the burden of then having to go back. Is this quite how I'd want to put it in a letter? No, but if I sent that to a GP on the patient, it's probably good enough in that sense.
And we would create a letter template to formulate it in the right structure as well. I think a few just key things to finish on as well is, we've heard the phrase earlier today, but as you can see, the key point here is there is a human in the loop. The AI that is generating that draft template, it is very much a draft template. It's not the final say. The clinician does need to review that as it goes through and before it's submitted into Rio as well. The other thing I would mention is this was a 35-minute conversation. It's summarized in about 2.5 minutes. So in terms of that time save and that documentation, that was done very, very quickly. So by the time we'd wrapped up and left the room, the summarization was available as well.
And can I just say something? I might even be tempted to do that before the patient left the room and show it to them. That's probably what I'd like to do.
And then the last thing I'll mention is offline functionality. So that recording process, the appointment diary at the start, that's all available offline. So if you are a community-based service, you can go back to back in your appointments, not need to worry about internet connection, and still use the app as well as we go. So that's a quick overview of what we've got. But yeah, if anyone would like to know any more, do come and find me afterwards. I'm here all day. And we can show you what we've got. Perfect.